Hello, everyone, and welcome to today's joint webinar with the International Consortium on Quality in Substance Use Disorders Treatment, ICQ. I am Livia Ediger, and I am the Deputy Chief Executive of ISSUP, the International Society of Substance Use Professionals. For those of you who are new to ISSUP and our online events, we are an international membership organization with over 44,000 members who work in drug demand reduction. We provide our members with access to training and opportunities to build networks and share knowledge through our website, our in-person and online events, and locally through our national chapters. If you are not yet an ISSUP member, please visit our website to sign up for free. I would like to welcome everyone to today's launch of a great resource for professionals working in drug demand reduction. On today's webinar, the International Consortium on Quality in Substance Use Disorders Treatment, ICQ, will launch and present a handbook for managers related to managing drug use disorder treatment services in line with international key quality standards. This resource is designed to help leaders and managers transfer current technology on what works and what is efficient management in drug treatment into practice. It enables managers to audit and improve their progress in meeting international key quality standards and to improve their outcomes for patients and communities. The management handbook was authored by Annette Del Pereira with input from ICQ colleagues and a group of drug treatment managers from around the globe. Annette and Rita Notarandrea, who is the global lead for the International Consortium on Quality in Substance Use Disorders Treatment, and Joe Rivas, the program officer for Latin America and Caribbean at Colombo Plan, have joined us for today's session. We from ISSUP would like to congratulate ICQ and Colombo Plan for the creation of this great resource, and also thank the U.S. Department of State's Bureau of International Narcotics and Law Enforcement Affairs, INL, for their support. Before we get started, I'd like to go over a few logistical things. For those of you who want to rewatch the webinar or share it with your network, the recording will be available on our website and our YouTube channel. In this session, we will not, usually we have a Q&A session, but this time we will not have a Q&A session, but you will at the end, our presenters will share their contact details so you can actually direct any questions that you have directly to them. And for this webinar, we offer interpretation into Spanish because the handbook will be available in both English and Spanish. So I will just very quickly and say all of this in Spanish as well. Buenos días a todas y todos. Para los que quieren seguir el webinar en español, ofrecemos interpretación al español. Mi colega Kojo va a poner la información para conectarse al webinar, a la interpretación al webinar en español y a la interpretación en el chat de la plataforma de GoToWebinars. And just a quick reminder that the webinars hosted by ISSUP are provided for informational purposes only, and they are educational in nature and do not constitute medical advice, diagnosis, or treatment. And I would like to ask Joe Rivas, the program officer for Latin America and the Caribbean at Colombo Plan, to please offer her welcome remarks.
Thank you, Livia. On behalf of Colombo Plan, I would like to welcome all of you to this important webinar. I would like to thank also to INL for its support and for trusting Colombo Plan to implement this project to assure quality services in treatment centers. Finally, I would like to thank the advisory group of ICQ for the contribution to the project. Thank you all for joining us today. And I'm going to leave you with Rita and Annette that are going to deeply follow the manual for you. Thank you.
Thank you, Joe, and thanks so much for joining us today. And now I would like to introduce Annette and Rita. Annette Del Pereira is an international consultant for Colombo Plan. Annette has worked in the area of substance use disorder for over 40 years. She is currently CEO of Naufa Treatment Center in Qatar and director of a management consultancy company specializing in working with international organizations on substance use disorder treatment and prevention. She has contributed to key international documents and projects on drug use disorder treatment system and services standards for UNODC, WHO, Colombo Plan, the European Union Drugs Agency, EUDA, and has worked with over 20 countries in implementing quality standards and providing training. Previously, she was a UK government advisor on the Advisory Council on the Misuse of Drugs, a strategic director of Central Northwest London NHS Trust with responsibility for addiction and offender healthcare directorates, and was an executive director of quality at the National Treatment Agency for Substance Misuse. Her background is in psychology, and she started her career in residential rehabilitation services and community drug services in the 1980s. And Annette is joined by Rita. Rita Notter-Andrea is an international consultant for Colombo Plan. She is a strategic senior executive with over 38 years of leadership experience in the Canadian healthcare sector, and more specifically in both the mental health and substance use and addiction fields. Rita spent 21 years in the mental health sector, 13 of which included operating a psychiatric hospital, and 16 years in the substance use and addiction sector. Before retiring, Rita was CEO of the Canadian Centre on Substance Use and Addiction, CCSA, for 8 years. CCSA is Canada's only national organization with a legislative mandate to address substance use and addiction, and was established over 35 years ago. This role led to activities with accreditation bodies in Canada to improve the care and health outcomes of people who use drugs, and to collaborative initiatives with international organizations and partners including UNODC, WHO, INL, CCAT, and EUDA. All of this latter work focused mainly on improving quality in substance use disorders treatment through the development of international evidence-informed quality standards and mechanisms, and on improving health outcomes for people who use alcohol and other drugs by improving the quality of services and supports they want and they need. Currently, Rita is the global lead for ICQ, the International Consortium on Quality in Substance Use Disorders Treatment, which is an initiative of the Colombo Plan. Annette will provide us now with an overview of the handbook. Annette, over to you.
Thank you very much indeed. And good morning, good afternoon, and good evening to the ISSUP family. And thank you very much to ISSUP and Livia for the kind introduction and hosting the webinar. And thank you to Joe for coming on. That's great. I'm just going to share my screen, if I may, and then we'll dive into the book itself. Okay, so play start. Just checking that you can see the slides. Yeah. So I'm very pleased to speak with you today at the launch of Managing Drug Use Disorder Treatment Services in line with the International Key Quality Standards, a handbook for managers. Let's just call it the Management Handbook from now on, because it's a bit of a mouthful. Now, this document has been a long time in development. We actually had a draft of it at the ISSUP conference in 2022. But then we went through a process of review by international organisations and international experts from around the globe before finalising it and then taking it to production. So we're very, very pleased to launch this today. I'd like to start with a question, a rhetorical question, if I may. Many of you who are in positions of leadership and management out there. Now, can I ask you, how many of you do you think have received adequate guidance or qualifications or training or mentorship in how to do your job as a leader or a manager? Okay, I'll come back to that question shortly. Okay, so let's move on. So in this presentation, we're going to cover a little bit about why we developed the Management Handbook, some background around the international guidelines and the key quality standards. I'll do a brief overview of the contents of the handbook, and then come on to some comments about responsibility in leadership and management roles. And then I'll hand over to my dear ICQ colleague, Rita, to wrap us up and call us to action. So let me tell you a little bit about the backstory. There is a big backstory to this document. So this document actually builds upon decades of work that was undertaken by international agencies on quality assurance in substance use disorder treatment. And it includes many seminal works, including the WHO and UNODC International Standards for the Treatment of Drug Use Disorders, the UNODC Quality Assurance Toolkits for Services and Systems, and all of the training and technical assistance that went into countries. It also builds upon European Union standards. It also builds upon standards that were developed by COPOLAD and CCAD, and the quality assurance work that was done in Latin America and the Caribbean. There's very significant work done there in partnership with the European Union. And it also builds upon the standards that were done by the African Union. It also referenced and looked at many sets of standards around the world, and also the standards that were undertaken by quality assurance organisations. So there's a very big backstory to this, and I think that this document actually stands on the shoulders of all of this work and wouldn't have been possible without all of this work. Okay, so by 2020, we had all of these sets of standards from these different international organisations around the world. And some of these are very extensive documents with significant numbers of standards. And the international organisations came together in 2020 in recognition that there was quite a lot of sets of standards out there, and that may be a confusing landscape to people trying to implement. So it was kind of, which standard should we implement and which should we not? So 2020 and 2021, the international organisations had a series of events to try and form a consensus about what was the smaller set of the most important substance use disorder treatment quality standards that were common to all of these other sets of standards. And this resulted in what we call the key quality standards. And there's 22 of them with 59 criteria. And these were released by UNODC in 2021. And this document is one of the core documents for the International Consortium on Quality. Okay, so let's come on to why did we want to develop a management handbook? And I'll come back to the question that I asked from the outset about how many leaders and managers of drug treatment services are trained in management and leadership. Now, I'm sure that many of you are, and in some countries it's a requirement to have a management qualification to be in a management or leadership role for treatment services. But I also suspect that some of you have had to learn on the job, or you're more self-taught, and especially clinical leaders whose focus really has been on clinical training. I mean, there's a lot of management training out there, but that tends to be generic, relating to health and social care, and not specific to substance use disorder treatment. And I think we can all recognise from the outset that leadership and management is not easy in any kind of healthcare, let alone substance use disorder treatment, where the treatment technologies, the guidelines and the standards are complex, and sometimes we have to rapidly pivot to match some of the issues that we face because they change rapidly. Okay, we've got this variability in the requirements and the competence of our managers and leaders in the sector. Now, we do, however, have very, very good evidence that treatment for drug use disorder it works, it's cost effective, and it can have a very positive impact on individuals and communities if the treatment is evidence-based and of good quality. And as outlined earlier, we've got an excellent range of international standards and guidelines on substance use disorder treatment. However, part of the gap that we faced is around implementation. So how do we implement all of this, the guidelines and the clinical guidelines and the standards, particularly where we've got variability in management and leadership ability, and we haven't got any specific guidelines to help the managers implement. So this is partly why we developed the management handbook. And at this point, I'd like to thank Dr. Mariana Montenegro for identifying this gap. And in a conversation one day, we were having this conversation about, okay, what can we do to help the managers and the leaders in substance use disorder treatment services? And I told him that many years ago in the UK, my dear colleague Peter Child and I had developed a kind of a management handbook on how to do this. But this was 20 years old and out of date, and it would need a significant amount of work to bring it in line with things like the key quality standards. But Mariana believed in this as a project, and therefore that's what we did. Now, the Management Handbook is dedicated to the memory of Peter Child, who sadly and very unexpectedly passed away at the end of last year. He knew this was coming out, and he would be very proud at the launch today. So, and I'd also like to thank all of my wonderful colleagues that have been involved in the development and review of this document. Okay. I think it's really, really important to recognise also that there is evidence on the effectiveness of treatment and treatment interventions, but there's also a very substantial evidence base that effective leadership and management in healthcare services themselves is associated with improved patient safety, a higher quality of care, and better health results. And I've just put some key points up there that refers to some of the big international work that's been done. There's numerous studies and systematic reviews and reports, particularly from WHO. And they say things like, okay, services with strong leadership, effective organisational processes and continuous quality improvement have lower rates of medical errors, infections and adverse events. There's also good evidence that good management leads to optimal resource utilisation, reduced waiting times and better access. And this can also positively influence health outcomes. And there are a lot of references in relation to general healthcare, generic healthcare, but there's also references that relate to substance use disorder treatment. And this makes me think of the seminal work of Professor Duane Simpson et al., who did all of the big data outcome surveys way back couple of decades ago, but they also published quite a lot about service effectiveness and organisational readiness for change to implement. So there's evidence that good leadership and good management leads to better outcomes. Okay, so hence the Management Handbook. So what is it? And I'm going to give you a very fast overview of the document now. So the content covers introduction. Then it goes into some of the areas that are covered by the key quality standards. And these are effective management, individualised person-centred treatment, providing interventions that are evidence-based, monitoring service access, performance and patient outcomes, ensuring services promote patients' health, safety and human rights, and auditing your services using the key quality standards. So let's go through each one of these very briefly. Now, the sections that relate specifically to the areas of content around the key quality standards, each of these sections describes the requirements for good practice in line with the key quality standards, gives some examples, and it outlines the relevant standards and criteria, both in relation to the key quality standards and the United Nations Office on Drugs and Crime Service standards, and then provides a practical checklist of each standard and what evidence managers and leaders can provide to see whether or not they meet the standard. And there's an example there on the right-hand side of the screen. All right, so let's turn to the introduction. Okay, so the target audience for the handbook are those involved in leadership and management and quality assurance of specialised drug use disorder treatment services. Okay, now it also may be useful for those that are involved in funding drug treatment services because it kind of would help in terms of service specifications, etc. Let's unpick what the specialised drug use disorder treatment services mean. I'll say two things here. These actually do include drug and alcohol services. So when I say drug use disorder treatment services or drug treatment services, I mean drug and alcohol treatment services. And services that are specialised are those that are designed primarily to treat people with substance use disorders. But we know that many services also treat other conditions such as mental health. And this handbook may be helpful for health services that have a partial remit around substance use disorder treatment services as well. Okay. Another thing I'd like to draw attention to that's in the introduction to the Management Handbook is that international guidelines, the handbook very much promotes implementation of recovery-orientated systems and services. And here recovery is defined as helping patients or clients gain voluntary control over their substance use, improve their health and well-being, and integrate into society. So treatment is more about treating an illness and providing short-term interventions. A recovery-orientated approach is also about helping patients build recovery capital in a number of different life domains. It's about empowerment. It's about working in a local partnership of services to meet the multiple needs of patients and their families. And of utmost importance, I think, it's also about providing hope to patients and families that they can and do recover. So let's move into the body of this document and let's look at the first section. So the first section outlines what is effective management and what are the standards relating to this. Okay, now there's several quotes that have real resonance for me in terms of this section, particularly about what is leadership and what is management. So leadership, I think, is a ill-defined term sometimes, and here with leadership, I think it's doing the right things. Now, what I mean by that is that it's ensuring that the service has a mission, a vision, a values, it has a strategic plan, it has an annual plan, and it gets the whole organisation pointing in one direction to deliver its outcomes. So that's kind of what you think about leadership. The leadership is doing the right things. Management is a bit more about doing things right. So this is managing the service in line with the vision and the mission and the values and the plan and evidence-based interventions, etc. Then in the management handbook, we come into sections in terms of managing different aspects of the service. So managing financial resources within budget, managing contracts and funders, human resource management, which is a very, very important area, as we all know, for drug treatment services, managing facilities and equipment, managing patient record system and data governance, and then managing and having quality assurance systems that underpin everything. And the handbook describes the requirements of each of these sections, cites standards, and then it indicates to the manager what their responsibilities are in each of these areas. Now, I've got another quote on this slide, and that is that you do not rise to the level of your goals, you fall to the level of your systems. And again, this is another quote that has real resonance for me as a CEO, because the handbook has a real big emphasis on ensuring that a service has the correct systems in place that underpin management, which underpins leadership. So this includes things like having written policies and procedures that are operationalized and monitored. Okay, so and if the systems are not in place, it's very, very unlikely that the service will achieve its goals. So there's a big message in terms of the management handbook in relation to, okay, put these systems in place, please, in line with the key quality standards, and then you're much, much more likely to achieve the goals of the service. And at the end of the day, the goals of our services are to improve patient outcomes and the outcomes of communities. Okay, let's take a look at the next section. So the next section is about ensuring patients or clients receive individualized, person-centered treatment that fits their needs. The section covers good practice and standards around screening and assessment, risk assessment and diagnosis. It also has a section on gaining informed consent from patients. It covers the very important area in terms of treatment planning, review, discharge and aftercare planning. It looks at working in partnership with other providers to meet the patient needs, because one service can rarely meet the diverse needs of the patients that it's treating. It has some considerations for different groups of patients in line with international standards. And then it has an important section on involving patients in service design and service delivery. And that's particularly important, I think, in our area of health and social care, given the role of our experts by experience and positive evidence base regarding the impact of mutual aid and peer support in helping patients achieve recovery outcomes. Okay, the next section in the handbook looks at how we can provide interventions that are evidence-based. And again, from a management perspective, what does the manager need to have in place to be assured that they are providing interventions that are based on science, up to date, and that all of the staff are operating in line with evidence-based practice. Okay, and really the handbook stresses the importance of having a documented approach. Now, what this really means is that the service is advised very strongly to have a written model of care, and that all of the interventions that it provides should be written down, described well, underpinned by operational manuals or standard operating procedures, and that all of this should be in line with the latest evidence base. They should be dated and they should be regularly reviewed. Okay, these are not, they're not documents that are dusty and left on a shelf and not doing anything. These are live, active reference points. And the staff providing interventions should be specified in the standard operating procedures or the operational manuals, and the staff should have read the documents and should be trained and be competent in providing interventions in line with these written documents. And managers are then advised to audit staff practice, case note records, etc., etc., in line with the standard operating procedures and the model of care, to ensure that there's fidelity to providing evidence-based practice and there's consistency in practice across all of the staff in the service, and there's a documented approach in relation to that. Now, the Management Handbook covers interventions in various different areas, and this includes interventions to reduce the negative health and social consequences of drug use, such as overdose prevention, preventing the spread of blood-borne viruses, etc. Psychosocial interventions or talking therapies, and these are often described as the golden thread that runs through every type of drug use disorder treatment services. Pharmacological interventions, so anything involving the prescribing of medication, and recovery management interventions, such as helping people build recovery capital in various domains in their life. Now, when a manager takes the handbook and have a look at it, they may realise that they don't provide all of these interventions. So the managers are advised to look at their scope, look at the scope of the interventions that they provide, and then pick the ones that they provide, and the ones that they don't, those standards won't apply to them. So there is a tailoring that can be done by the managers when using the handbook. Okay. Now the next section is about the service ensuring that it's monitoring its performance and its outcomes, and it is trying to improve the outcomes, particularly for patients. And the areas that this covers are ensuring timely access in terms of standards, performance management and monitoring, and outcome monitoring and management. Now, many types of drug treatment services will have reporting requirements about their performance, and these may come from funding bodies or health insurance services or higher boards if they're part of a larger organisation. So they may have to be reporting back on how they're doing on these targets anyway. And some of the types of performance data that may be monitored may be things like, okay, access, it could be waiting times. If it's an inpatient or residential service, it could be bed occupancy. For all types of services, it could be, okay, what's the numbers of patients in treatment at any time? What types of interventions are the patients receiving? Are the patients being retained long enough to benefit from treatment? How many complete their treatment episodes, and how many are positively discharged? Okay, so, and in relation to the key quality standards and the management handbook, whether there are reporting requirements from external bodies, the service is expected to set its own key performance indicators and monitor those in order to consistently check on its performance. And then where the performance is falling short of where it's trying to be, to seek to improve those. So there's a little kind of diagram on the right-hand side of the screen. So setting KPIs, monitoring these by collecting data, scrutinizing the data on a regular basis. Many services do this on a monthly basis, and then putting in action to improve if required. Now, the second part of this part of the management handbook and the key quality standards is about monitoring and improving patient outcomes. I think that this is a developing area for many treatment services. It's not easy to monitor patient outcomes, but it really is something that we should all strive to try and do, because it's really, really important that we know what impact we're actually having on our patients, and then try and improve that over time. And the management handbook gives examples on how to do this. All right. The last kind of section in the management handbook that relates to the key quality standards is quite a broad-ranging section, and it covers ensuring services promote patients' health, safety, and human rights. So it's got quite a wide content here, and it covers the very, very important area of ensuring that patients are treated with respect and protected from abuse, malpractice and discrimination. Now, sadly, I suspect all of us have witnessed stigma and discrimination against this patient group and their families. It's common around the world. And sadly, some of us may have also witnessed some malpractice in some services or by external healthcare providers or whatever. So it's very, very important that we have standards around this, and that this is monitored, and this is explicitly addressed by managers and leaders. Okay. On the topic of respect, I think this is a very interesting area. There is evidence for some very large-scale patient surveys that patients that report that they're being treated with respect actually also report better outcomes. So it's an important concept, and it's often a very good indicator of quality and better outcomes. The management handbook outlines the importance of informing patients of the service rules and policies and procedures. This is not least to make sure that patients can give informed consent. If they're not informed, it's not informed consent. And also the importance of having an independent complaints procedure for patients. And independent means that basically they have a recourse to complain to somebody that is not their doctor or their counsellor or their direct caregiver. It's somebody else in the organisation, and those complaints, there's an accountability and a cycle of kind of the organisation looking at these. The next set of standards concern promoting health and social functioning in patients. And again, this fits back the recovery-orientated approach of treatment providers that all of the international standards and the key quality standards are trying to push for, and to ensure not just treating a drug or alcohol problem, we're actually providing holistic care approach, and we're really trying to empower patients to improve their health and their well-being and their education and employment and housing, etc., etc., etc. And many services, I think, really try very hard to do this. There's a set of standards and guidance in the document about cleanliness, infection control, fire and serious incident prevention. And these are very important for all healthcare providers. Cleanliness and infection control, although we're quite far away from COVID. Sometimes we're not that far away from it. And it's interesting. I was watching a TV program the other day, and it was COVID times. And I was suddenly kind of almost shocked to see everybody wearing personal protective equipment and the things that were put in place to prevent infection control. And we need to do this appropriately now and be ready in case it ever comes back in again. Fire prevention is in there because we've had some awful incidents in our field whereby we've had fires in drug treatment services, and the treatment services have been locked, and there's been very severe injury and death amongst patients and staff. So fire prevention is very important to put in the standards. And then the final bit here is in terms of serious incident prevention. And I just wanted to say to you, you know, all services have incidents. It's inevitable. And the best thing that we can do is ensure that these are transparent and we're trying to learn from mistakes. And if the incident is a serious one, that there is some kind of a process of really rigorously looking at what went wrong and what could be improved and putting in place a quality assurance cycle. Okay, final section in terms of this is medicines management. And as you know, this is of critical importance for substance use disorder services, any of them that store, prescribe or dispense medication, particularly in relation to controlled drugs. And this all must be done safely, in line with national guidelines, in line with protocols, and all efforts need to be made to prevent diversion. Okay, great. Now, this is the last section in the handbook, and basically it's about how managers and leaders and quality assurance staff can audit their services using the key quality standards and the checklists that's scattered throughout the management handbook. And so it tells how to plan and allocate resources for auditing, how to adapt the key quality standards so that they fit the scope of the service, the target groups of the service, and the cultural context of the service, how to assess against the key quality standards, how to report, and then some tips on how to improve services if things are found to be lacking or not meeting the standards. Okay, so this is my last slide before I hand over to my dear colleague Rita. And I just wanted to conclude by saying that I think that leadership and management of substance use disorder treatment services really is a great honour and a great responsibility. At least it has been in my career, and I know it is for many of my colleagues. And it's not easy, yeah, but it can be immensely rewarding, particularly if we can see that we're making a positive impact on the lives of our patients, their families and communities. And I was kind of looking for an analogy around managing or leading substance use services, and I kept coming back to the, you know, with great power comes great responsibility quote that was made popular by Spider-Man. But if you research this sentiment actually goes back for many centuries and through many religions and in many different countries. And it also goes back to ancient Greece and the legend of Damocles. And Damocles is an interesting guy, and he was a courtier in a court of the king, and he was kind of envious of the king being on this seat of power, and envious of the king with all of the power and the responsibility. And so one day the king said, okay, you can have my seat, have the chair. And as he did so, before he did so, the king put a sword above the throne, and the sword was held by a single horsehair to signify the great responsibility and the precariousness of seats or chairs of responsibility. And to me, this seemed a kind of a fitting analogy, particularly in this uncertain world where we're all having to manage change and changing patterns of drug use and these sometimes difficult services to manage. However, the management handbook is designed to help managers take away some of the precariousness of the big chair, and the big chair and the leadership and the management of substance use disorder treatment services. It moves the big chair to a safer place. not under a precarious sword, but underpinned by good plans, systems, documentation, and accountability that standards are being reached. Hopefully, the handbook will help the current and the next generation of managers and leaders manage substance use disorder treatment services in line with the key quality standards to get the best patient outcomes we can, because that's why we all do our jobs. Okay, thank you for listening.
Thank you, Annette. If you could show the next slide. With great power comes great responsibilities. How that last slide, what was shown there, I would actually add the word knowledge. With knowledge comes great power, comes great responsibility. And so my slides are to share with you the responsibility we all have to improve quality when it comes to substance use disorders treatment. And if you could show the slide on call to action, what we really are addressing is a need that's out there. Those of us in the healthcare system know that there's always a gap between what we know and what we do in practice. So this tool that we are sharing with you all today is about filling that gap. It's our response to the need that is out there when it comes to our services and when it comes to our systems. So this tool is really a knowledge translation tool. And if you know anything about knowledge translation, it speaks to bringing the knowledge together, which is what we have tried to do, then sharing that knowledge, which is what we're doing with you today, and ensuring that there is a good understanding of that knowledge. And then, of course, we want you to use it, to use it, to use it. So the title of my call to action is really about application, and it's really about implementation, because we're all here to do what's best for the people we serve. Now, as Annette has shared, it does promote international standards. It does speak to the latest evidence that is out there. It provides the guidance on how best to ensure adherence to the evidence in a very detailed way. And it speaks to the policies that need to be in there, the practices, some of the plans that should be in there. So it's very detailed in helping achieve that adherence. And it offers quality assurance mechanisms that not only are sustainable, but helps those that are applying it ensure that there's some fidelity to the standards, and more importantly, to the evidence that is already out there. So the call to action is we have tried through this tool to make it as simple as possible, though it isn't simple, we all know that, but we have tried to take that evidence and provide a guidance to you through the suggestions of evidence on how to ensure adherence of your practices to the latest research. And that's what the call to action then is about: do the best we can to apply this, to look at it, because we also believe that through this knowledge comes the power, and comes the power that's given to you to make a difference. Next slide, please. The other call to action is increase awareness. So as we increase awareness, as we share what is out there, we are relying on you as well to increase awareness of the availability of this management handbook. We believe that together, as I mentioned earlier, we can make a difference to improve quality. We have to make a difference. And certainly when you look at the World Health Report, we know that we need to make a difference in terms of ensuring safety for the people we serve, and ensuring that they are provided interventions that are in line with human rights. These standards are based on the evidence. So application, when you are looking at these standards, you know that they are based on the evidence. You know that there are quality assurance mechanisms built right in there to help in terms of applying this evidence. And we are giving the leaders and the managers the tools that they need in getting the job done. and in ensuring that we are all filling that gap between what we know and what we do in practice. And it also gives leaders and managers an opportunity to use these to provide training opportunities for the staff as to what is out there and what can we all do with what we know right now. This handbook is really there to recognize good practice amongst yourselves as a team, to a challenge for practice, and then to encourage continuous improvement by putting in place some things that are improving on what you're already doing. And even though some of these things, certainly as CEO trying to implement major documents, I know this seems like a lot of work. And I know that we say, I'm already busy with so many clients, waiting lists, waiting times. We all have, and we've all faced those issues. But I would say, take one standard at a time. And as your meetings with the team, take one standard and look at what can you do. So the call to action is look at this, increase awareness of it, increase your own knowledge of what is in there, and then together with your teams, look to implement change because we can all improve on what we do. And that's what this tool is about, is how can we all do one thing to improve quality in helping outcomes for the people that we serve. Final slide is really about access to this document. So what was said earlier is this document can be downloaded. It is free. So please download the document and share it amongst your colleagues and your team. If you have any questions, we are available to answer your questions, so please use our email addresses to send your questions along to us. They will help us improve in terms of any courses we provide on this, but your questions will help us as we continue to disseminate this wonderful tool that has been developed for the system. So thank you in listening to us. Thank you for participating. And thank you for using the document.
Rita and Annette, thank you very much for presenting such a great and useful resource. It was very interesting and informative to learn about, well, first of all, the background of the standards, the knowledge, and the standards that the handbook has been built on, to learn more about the core sections of the handbook, the examples that are offered in the handbook, and ultimately how professionals can audit their own work, apply the standards, and improve their work. I'm sure this handbook will support managers in transferring what works and what is efficient in management in drug treatment into practice. As you said, Rita, the handbook is available. It's for free. It is now also on our website. So we have shared the link to the handbook in the chat for those of you who want to access it now. We will also include the link to the management handbook in the follow-up email that we will send to all attendees after the webinar. And we hope, as Rita said, that you will share this tool, or in Rita's word, this knowledge translation tool with your colleagues and with your networks. As Rita just mentioned as well, if you have any questions, please direct them to Annette and Rita. You have their contact details on the slide, and I can already tell you, Annette and Rita, there are questions. So yes, we're just checking the chat. Thank you all for joining us and for also participating and sending us your comments and your questions. And also, again, congratulations to you, Rita and Annette, and to your colleagues at ICQ, and Joe as well, to Colombo Plan for the creation of this wonderful resource, very useful resource. And again, we would like to thank the U.S. Department of State's Bureau of International Narcotics and Law Enforcement Affairs, INL, for their support. Thank you all for attending today's webinars. You will receive the follow-up email within the next 48 hours with the link to the recording and with the link to the management handbook, which will be available in English and Spanish. And I would also like to thank my colleague Kojo Adu, who most of you don't see because he is working behind the scenes, making sure that everything runs smoothly as our digital events coordinator. And on behalf of ISSUP, thank you for joining us today, and we hope to see you in one of our future webinars.